Hi, Keith Mirante here with Coastal Chiropractic in Madison, and today we're going to be discussing, in the heat of the moment, right after a motor vehicle accident, a lot of people are in a state of shock, so we're going to discuss what you do in the minutes right after a motor vehicle accident, and this is going to be a two-part series, so stay tuned. And so can you describe to me, like, what should we do in the heat of the moment right after a motor vehicle accident?
Sure. Obviously, it's a trying time. Something traumatic has just happened, so people are very nervous and trying to get their bearings. But there are a few tips that we'd like to give you that may help you later on in those first few critical moments after the collision. The first one is, regain your composure, take a breath, and call the police. Call, 911, tell them where you are, tell them what happened, so that they could provide medical attention. The other thing that you might want to do is, if you are able, because obviously depending on the severity of the injuries involved, but if you are able, take photos at the scene. I'll give you another alternative to that. If you are able to call a loved one to come to the scene, a loved one, a friend, whatever, if you are able to call somebody to come to the scene, you might want to instruct them to take photos of not only your vehicle, the vehicle of the person that hit you, but the overall crash scene. Once again, that's helpful later on. There are other opportunities to get photos of your vehicle, but there's only one opportunity to get photos of the crash scene. The other thing is, if there are any witnesses involved, oftentimes when there's a collision, people may stop to offer their help. Many times, you don't know if you're hurt, and I'm sure Dr. Mirante has heard this many times. People's bodies go into shock, so at the time they think they're fine. But if somebody comes to the scene to offer their help or assistance, the best thing you can do is ask them for their name and telephone number, get their contact information, so that they can later serve as a potential witness in any kind of litigation or claim that's forced to ensue because of what's happened.
Another thing to consider is, I know nobody wants to call the police, and especially if it's one of these more minor accidents, you feel like it's going to be a hassle, you're on your way to somewhere, it's just easy to exchange information. The tough side about that is that oftentimes insurance companies want that police report to issue coverage of any kind, and you could be stalling your case fairly significantly for a week, 2 weeks, even a month sometimes, even in standard cases where there isn't that police report. So it's really important to try to get that down. Another thing is, when the police come, the standard question they ask you is if you're injured. And a lot of people, either because they're in the state of shock or just not thinking about it, or they may not hurt right at the particular minute, will say things like, I'm not injured. Something you may want to keep in mind is, just like AnneMarie said, take a deep breath, think about what's bothering you at the time, and leave the conversation open. So for instance, saying things like, I'm in shock, if you're actually in shock, it's fair enough to say that. And say, I don't know what's hurting you right now, or whatever the case is. I think what you don't want to say is what we see in police reports all the time, where people say, I'm not injured, because they're just so overwhelmed with the situation, and then that ends up getting used against them.
Yeah, that always appears on a police report afterwards too. Passenger one or driver one said no injuries reported, and so, like you said, it's great just to leave it open if you know there may be possibly something in the future. So,
and Doctor, I'm sure you've seen many times when patients come in and they say, I wasn't feeling anything immediately after, I wasn't feeling anything the day after, but 2 or 3 days later, I started realizing that I was having pain in my lower back or in my neck or whatever the case may be. I'm sure that's a fairly common.
So that's one of the most common things, is usually 3, 4, even up to 5 days. Symptoms progress. And they really peak at about 4 or 5 days, so depending, of course, on the severity. And as I learned in school, if it's not documented, it never happens. So documentation is one of the most important things. So stay tuned for part 2 of this series, what to do in the heat of the moment of a motor vehicle accident.